Certain voices, some of them quite prominent, pushing to just reopen the country, want to pretend as if the coronavirus just does not exist, that we should reopen and get on with our lives and forge ahead. And there's a question, I guess, about, well, what would that look like, right, if you just pretended it didn't exist? And guess what? We have an answer. It's called the nation's meatpacking facilities. By and large, these facilities have continued to operate in the main as if nothing is happening outside there in the world with the virus. Employees working shoulder to shoulder for hours and hours, day after day. My colleague, Rachel Maddow, has done some absolutely incredible reporting on how these plants have become coronavirus hotspots. And today, the Centers for Disease Control released a new report on just how dire the situation is. It shows that meatpacking plants are among the biggest coronavirus clusters around the country, with 115 facilities across 19 states affected by the virus, nearly 5,000 workers infected. Those are the ones we've detected. That's about 3% of the workforce across those facilities. Again, that we've detected. And that is something workers and those advocating for them are really concerned about.
I work around over 1,700 people. That ain't safe at all.
These workers are very afraid. I mean, I'm getting phone calls all the time. All our activists are getting phone calls. Workers don't know what to do.
And what's going on in meatpacking facilities is just part of what we're learning increasingly about the virus, which is this. The highest risk situations are in closed spaces in tight quarters for a sustained amount of time. All right. So in addition to meatpacking plants, the CDC report points to long-term care facilities, places like nursing homes and psychiatric hospitals, and, as we have been saying on this show for months, correctional facilities, jails and prisons. In fact, the New York Times found that the top 10 coronavirus clusters in the country include a naval aircraft carrier, prisons, and meatpacking plants. That's the whole top 10. Joining me now is Alexis Madrigal, a staff writer at The Atlantic, who has been covering the outbreak and co-founded the COVID Tracking Project, which is a vital, essential collection of state-by-state reported data on testing and positive and rates like that on the coronavirus. Alexis, it's great to have you on. I want to ask you if between your work on the tracking project and what we're learning about where the biggest clusters are, what that means about where we are in the outbreak in the U.S.
Yeah, I think by the numbers, it just means we're in a new phase of the outbreak. You know, people have been talking about first wave, second wave. We're kind of seeing this mini wave right now where, you know, in the initial stages, you saw major metro areas with major links to international travel that were really hit hard. And now we're seeing a second wave, you know, that I think is epitomized by the meatpacking industry. You've got really high-risk workplace situations. You know, I was listening to an agribusiness guy from the University of Illinois who called the workplace conditions at packing plants the opposite of social distancing. And that's really where we're seeing these outbreaks. And I think it just speaks to we're in a new moment of this outbreak, and it probably requires different kinds of responses.
What do you mean by that in terms of how we test and target and what we do in those sorts of facilities?
Yeah, I mean, you know, if you have a big outbreak in New York, you can start testing lots of people. You can bring on the resources of these large states and rich areas. If you've got an outbreak at a Smithfield plant, you've got an outbreak at JBS, Cargill, Tyson, the other big meatpacking plants, you're going to have to test through the company. And I think that's one of the big things that's going to change is you're going to see a lot of testing of these workers. And I think they're probably already trying to figure out how to do that right now because we know that they're going to be kept open. This is sort of part of President Trump's plan, and it's part of sort of trying to keep the food system as stable as possible.
Yeah, I mean, the other areas we keep saying are prisons, which have been bad from the beginning and are intensifying, and elder care facilities, which, again, you know, these are what all three of those have in common, along with a naval ship, is inside close quarters, sustained periods of time. There was this amazing graphic of one South Korean call center, which we've shown on the show before, just gives you a sense of like what we know about the highest, most dangerous kinds of environments for transmission. This is a call center. You can see all the people on the top there in blue are the ones that got the virus. It seems to me that thinking hard about what you do in those situations is really key right now.
Yeah, that's absolutely right. And I think, one thing we know is that the air handling systems have tended to be really important. Like in that graphic that you saw, it's basically people who were all in the path of the air conditioning. And I think, it also speaks to the fact that we are learning so many new things about this virus. And we're learning so many things about the ways that it's transmitted. And because the U.S. is, in fact, the leading example of a country that's been hit really hard, we find ourselves in a position to learn a lot about the way that we are both going to be affected by this virus and also the way that we're gonna fight it. And I think in these group settings, one of the things that's going to be really important is a technique called group assaying. It's been done a lot for HIV/AIDS, where you're able to sort of use a smaller amount of test materials and group people together to get more out of fewer tests, but still test a lot of people. Because at the end of the day, if you want to keep these meatpacking places open, you're going to have to basically test those people every day. And right now, we can't really do that, but we're going to need to.
Yeah, that point about testing, just that in these environments, if you're going to have a nursing care facility or you're going to have people in prison or you're going to have the meatpacking plant, the only way out is constant repeated testing so that you can find it immediately and isolate immediately. There's no way around that. And we don't have the capacity right now. Alexis Madrigal, who's been doing amazing work in tracking what our test capacity is and is not. Thank you so much, Alexis.